I would like to welcome everyone to Discussion 11, Name Your Favorite Consumer Health Resource Lightning Round. And I'm borrowing this concept of what I wanted to do for today from many of the events that are going on at the Medical Library Association conference and some that happen at chapter Medical Library Association meetings. And I just thought that it would be really cool to find out from a variety of different people what they found were really useful consumer health websites outside of Medline Plus, typical Medline Plus. So I got actually a lot of responses, and I've learned, just putting this together, I learned a whole bunch of information about that. So I am going to get started. First thing I want to do is I want to say that this is an international education program that provides free, short, on-demand training in consumer health resources and issues for librarians, information professionals, or staff with an interest. So if you take Beyond an Apple a Day in whatever format it is in, some people are taking the 2-hour off of our primary course page. Some people have taken 8-hour courses. That's fine. Whatever after that, however many hours that was, then you need to make up till you get to either 12 hours or 24 hours. So if you took the 8-hour Beyond an Apple a Day, you would only need 4 more hours to get to 12, but you need a lot more, obviously, to get to the 24. If you took the 2, then you would need 10 other hours after Beyond the Apple a Day. The video sessions will be uploaded, and I'm still having difficulties with that, and I'm hoping that that will be done. I know you all keep hearing me promise, and I'm really going to try to see if I can get him up this week. So credit for these discussions should be obtained only after completing the project evaluation and any pre-session reading. For this and the next session, there is no pre-session reading. This is all about the practical aspects. There are readings that I could give you, but I wanted to concentrate more on hearing the stories from the people utilizing the resources. So now, I want to bring this because I've had a couple of different questions and comments. Those people in Arkansas, Louisiana, New Mexico, Oklahoma, and Texas, through this grant, anyone who's an information professional, a librarian, anyone who's working in consumer health, hospitals, educators, and library staff can apply to have the fee waived for the CHIS application. So in order to do that, I've laid out basically the Beyond an Apple a Day. You're going to get all of those saved certificates. You can save them as PDF files. You're going to take those and you'll email them to me, and I have to have them by March 31st. The grant ends April 15th. I will be sending MLA the names April 1. So I have to have everything by March 31st. After I receive the certificates, I will put a list to MLA. MLA, once they get your name, will create a link that you will go in and you will complete, like filling out your title and all that other information. And then you will get your certificate in the mail, actually in the mail, within 60 days. You will also get a letter, though, from me, if you haven't already received one, thanking you for submitting and telling you that I will be submitting your name. So if you have an evaluation coming up with someone, with your boss, and you want to show, hey, I've done this, you will have a letter as soon as I get those certificates. I have one person who's I do not have a letter to at this time, but another person, and that's the only person. Everyone else who's submitted already has gotten a letter from me. So the rest of the details, if you want to read more about the project, is right there on the guides, LSU GeauxConsumerLA website. This is our project website. The places where you can get classes. The primary courses is listed, and the discussion group offerings. Those are both places where you can go to get the hours to complete enough to apply for the CHIS. All right? And you don't have to be in Louisiana, Arkansas, Louisiana, New Mexico, Oklahoma, or Texas in order to apply for CHIS. If you're outside of this region, you can still apply and pay for it on your own. This was meant to facilitate people to have all the education in one section so they could get it done and apply and put it on their resume, their Vita, and also to let their boss know how engaged they are in consumer health. So we want to thank the National Library of Medicine, National Institutes of Health for this grant. That is through the University of North Texas Health Sciences Center. I cannot express how wonderful it has been to work with them, and SCR has been fantastic in handling everything with us and been very supportive. Also, if you want to learn more about their grant services, all that information is there at their website because they have grants that you can apply for. Application cycle has ended already, but it's ongoing each year around January, so please make sure you check those out. So today, discussion 11, name your favorite consumer health resource, lightning round. So I have had, like I said, I got a whole bunch of different ones, and I'm going to try to go through these. I'm basically, for the transcript, I'm going to read what they've submitted. Yes, I'm reading what's on the slide. I know you're not supposed to do that, but for today, I'm going to go ahead and do that. So the first one is from Kitty Serling. She is Health Sciences Librarian at the Carl R. Ferris Health Sciences Library in Kansas City, Missouri. She's at the Research Medical Center. So she submitted something. I didn't even know that this website existed, and I was very excited to learn about it. Memorial Sloan Kettering Cancer Center, and there's the link right there. She writes, consumers like choices and bargains. Patients may be attracted to herbs, supplements as part of preventative health program or as part of integrative medicine approach to their health issues. They may have even grown up using herbs as part of their culture. Others may have been introduced to herbs via a variety of culinary arts. Since herbs and supplements are not regulated, their quality and potency may vary greatly between brands. So Memorial Sloan Kettering Cancer Center, a global leader in field of oncology, has created About Herbs, Botanicals, and other products. It is reassuring to know that the medical authority has produced a website to provide current and reliable information on a topic of interest to both consumers and to healthcare professionals. And you can see they have a wide listing over here on the left side. And this is, I just picked one point to kind of show you a little bit of the screen. And then she finally finishes up by saying, one can find information on the website by entering either the common or scientific name of an herb in a search box. One can also choose to search alphabetically. The search box can be utilized to search a medical condition as well. There are two levels of information offered within each monograph, consumers or for healthcare professionals. It does have an app that can be downloaded. Both formats are easy to use, easy to navigate, and have very readable print size and type. A comprehensive choice of topics is available. And as she said, there's an app for that. So that was the first resource. I did not know about this, and this is something that I've already bookmarked to be utilizing in the future. So I thank you, Katie. So Abby volunteered actually to talk about her resource. I am going to make her the presenter so she can talk about her resource when she shares the screen.
Julie?
Yes.
Hi. Okay. Awesome.
We don't see your screen yet, though, so you need to...
Okay. Let me see. There we go.
Perfect.
All right. So the resource that I chose to share, because we do see, especially here in Kentucky, a lot of cancer patients, is the National Comprehensive Cancer Network's guidelines for patients. So these are really nice comprehensive guides to various cancers and some cancer-related topics like distress in cancer patients. As you can see here, if you go to the website, you can tell it what you're looking for. They have an alphabetical listing of the topics. Unfortunately, not every site-specific cancer is covered, but for the ones that are, these are awesome. So these are freely available online. So if you click colon cancer, let's say, it will open the document and you can browse through. You can print these. Toward the end here in the, let's see here, making treatment decisions section, it has really good questions to ask your doctor when you are diagnosed and considering your treatment options. So I think that's a really helpful place for patients to start when they don't really know what to ask or what to think about their diagnosis. I will also say that these guides are available to buy via Amazon if a patient prefers to have a hard copy that they can sort of keep and use repeatedly. They're about $12 a copy usually, and they are frequently updated about once a year. And then there is an app, as Julie mentioned with the previous resource, that you can download, and that's mentioned down here on the screen as well. So I think that's about it, although I'm happy to answer questions.
Anybody have any questions for Abby? I have a question. You can print it if you wanted to, right?
Yes, you can. You can print the entire thing, and we do that for patients when they ask. For my library, we actually try to keep a printed copy available for circulation for patients because sometimes the cost can be a barrier, or even sometimes access to the internet. But they are an excellent resource, especially because it's usually on the doctor side. They're using the professional guidelines, and this kind of guides the patient through what their doctor is using to make those treatment decisions.
Oh, so because I'm so having background with clinical medical librarianship, I knew this website from the professional side, and I knew all of the guidelines and the app for that and everything else in that regard. So this corresponds with that information.
Yes. So this
that's
is
even better. I didn't even know this. I've been to this website probably 1,000 times, and I have never realized that it had patient information.
So
any part of it.
It's a really awesome. Personally speaking, my husband was a cancer patient, so I was familiar with the clinical side. Unfortunately, his tumor type was not one of these, but when I started working in this job, I was so happy to find these. Especially we have a lot of low health literacy patients that come in and they don't know kind of anything about where they're starting from their cancer diagnosis, and this pretty much takes them through, like, here's how it happened, here's how they diagnose it, here's what you're looking at, questions to ask your doctor, full color illustrations, all that good stuff.
Great. Well, Abby, I really appreciate you taking the time to talk to us about this and to share this resource.
You're really welcome.
And I'm going to take back control.
Okay.
All right. And I'm going to start sharing my screen again. And hopefully, okay. And I will post the slides, which will have all the links in there. And it's not going to look, Abby was actually showing real time. I just took a few of the screenshots of it. So. The next one is from Helen Ann Brown Epstein. She's informationist at Ventura Health in Mount Laurel, New Jersey. She wanted to make sure that people knew about a fee-based resource that she utilizes a lot called Nursing Reference Center Plus. She finds this information that's in there really useful. And granted, while a lot of times you have a lot of free information, it's good in this regard that if you wanted to purchase a product that's a good product, she said that this is one of those that the patient handouts are really liked by their nurses. And so she sent in this resource because she thought that this might be something that some hospital librarians especially may or may not know about and would want to know about if they didn't know. So the next one is from Dr. Krebs. He is University Distinguished Professor at the Center for Health and Risk Communication at George Mason University. And he sent in about cancer.gov. Now, a lot of people may know about cancer.gov, but something that I, once again, had been on this website, I did not realize that they have a live chat. So this is what he wrote. I like cancer.gov as a premier health information website. It is the official website of the National Cancer Institute and provides extensive, up-to-date, and accurate health information about cancer prevention, screening, diagnosis, treatment, survivorship, and research. He then says, the information provided on cancer.gov is formatted for both professional and lay audiences. It is updated regularly. There are interactive features such as live help. I had never noticed that before. Maybe I just don't see screens. I just never noticed that. That helps users access and make sense of health information. It can direct users to relevant clinical trials, cancer care, toll-free hotlines to information specialists at NCI, and to support groups that are accessible to users. It also can provide access to relevant literature to provide users with additional information. It is an open access website that is provided free of charge to all users. The next one, I didn't even know this website existed, So Michelle Spatz was really great in sending this in. She does have a conflict of interest. She works at Pacific University Libraries under an NNLM sub-award called Knowledge is Health, which is the administrative support for NNLM's role in All of Us. This is brand new. I don't know how many of you know about this project, but she writes, the resource provides information on National Institutes of Health All of Us research program, which will be officially launched later this spring. The NIH All of Us research program is partnering with the National Library of Medicine through its National Network of Libraries of Medicine. The people who made this program, our program's possible, to work with public libraries to raise health literacy and to promote the use of public libraries as places to go for health information. The All of Us research program itself is described as a historic effort to gather data from 1 million or more people living in the United States in order to accelerate research and improve health. By taking into account the individual differences in lifestyle, environment, and biology, researchers will uncover paths towards delivering precision medicine. One of the things she wanted to point out was the about. This talks about the project, and it's going to have, the resource contains information about All of Us research program, how people can participate, and what it hopes to accomplish. And then she says, I think it's important for public librarians to be aware of All of Us website and this research initiative because their patrons may ask them questions about it as the national launch gets underway. Through membership in NNLM, public libraries will also be able to apply for additional funds for programming related to supporting staff health literacy and or community outreach in support of health and wellness. So as I said, I didn't know that this website, I knew that the project was out there. I did not know that this website was up already. Good to know that there's going to be one spot that we can go to if we want to find information out on this project. So thank you, Michelle. The next one, we had a Canadian who submitted. I was so excited. Darlene Bowman submitted. She is at Kingston Health Sciences Center in Kingston, Ontario, Canada. She does work for Kingston Health Sciences Center, so that's a conflict of interest if you want to say. She submitted their glossary of terms for patients, families, and visitors. So she writes, Kingston Health Sciences Center in Kingston, Ontario, Canada has recently added a plain language glossary to its corporate website, which it makes you wonder. I wonder how many other places should have a glossary. But that's just my side note. The glossary contains thousands of words and terms that patients, families, and visitors may encounter when they interact with the healthcare system. It is also a resource that healthcare providers use to improve the understandability and usability of their verbal and written interaction. So it says the glossary offers several formats that are easy to find and use. Stakeholders using the glossary can send comments and feedback to a dedicated email address so the glossary can be revised and improved upon. So it's actually like a living, breathing resource. I thought this was really interesting, especially, just abscess, sore wound infection, a tender swollen lump. I mean, these are the types of things that we need to think about when you're interacting with patients who may have normal literacy level but not understand medical terms, and also those with lower health literacy. So thank you. So Kathy Boss in New Jersey, she's the Booker Health Sciences Library at the Jersey Shore University Medical Center in Neptune, New Jersey. She submitted Toxtan, and she writes, Toxtan introduces toxic chemicals and environmental health risks that one might encounter in everyday life, in everyday places, in various neighborhoods. Selecting a location in town, city, farm, port, or U.S. Southwest on the neighborhoods page, which was this page, will identify health risks to that particular location. Clicking on one of these locations accesses internet resources on chemical and environmental concerns one encounters in that location, as well as a list of over 40 chemicals found in the location. So if you go in, the information is provided from ToxNet and Medline Plus resources from the National Library of Medicine, as well as other authoritative resources. So basically, it's a kind of a portal linking you back out to other resources, which is very interesting how it's all tied together. So in this case, here's the city page, And you can click on particular areas, like this one's the drinking water. And she writes, I love the layout of the site with the colorful graphics and the child-friendly layout. The site provides curriculum knits that can be used in science club or an introduction to environmental careers. And some areas and locations will even pull up more detailed information because, you know, especially if you're working in healthcare, the toxins just in general around you are pretty bad. So it breaks even those things out if there's more detail needed. So thank you, Kathy. So Jessie Kinsella, I'm hoping that's how you say it. She is a medical librarian at the Department of Veterans Affairs, Central Western Massachusetts Medical Center in Leeds, Massachusetts. She works for the Veterans Affairs, and the reason why that is important is because she submitted the Veterans Health Library, your information source for health information. So she writes, it provides vetted health information specifically for veterans, including diseases, mental health, and related veteran resources. The site is easily searchable and freely available to the public, so veterans, loved ones, and care providers can readily access the content. So this just kind of gives you a little bit more of what's available on the website, and it shows, you know, if you're new, suicide prevention, understanding different things, veteran resources on the right if you've had certain exposures, like my brothers were exposed to Agent Orange when they were in Vietnam, so different areas like that. So Aman Kerr, Community Health and Engineering Librarian, I'm going to email him afterwards and find out how he becomes a Community Health and Engineering Librarian at the University of Pennsylvania and Philadelphia, PA. And he submitted I did not know about this website at all. Health Reach, Health Information in Many Languages, is an online consumer health information resource which includes information in text and multimedia formats in an assortment of languages. Health Reach is managed by the National Library of Medicine, so I should have known about it, but I didn't, which means it is a trustworthy source of online information. I like to use Health Reach when I need information in a language other than English. So I thought that was a very good resource that was submitted. And here it goes down a little bit more. It shows you how it's got patient materials, provider information, and A to Z index. What I found very interesting is because of the opioid crisis, they have special materials just on that. And I found that very, very interesting, that was one of the things that they had up there. So that was, all right. So Catherine Arnott Smith, who was a previous speaker in this discussion series, submitted a resource that she likes a lot, and that is Lab Tests Online. So she writes, it is a very rich site which provides patient education to those patients who want in-depth content on what, why, and how of laboratory testing, as well as a quick lookup and overview of common and uncommon laboratory tests for those patients who just want a quick lookup to understand what the doctor has ordered. As a patient, as well as an educator training future medical librarians and quality sources, I like to use it as an example of an effective patient education that works at multiple levels. I find my most common use of this site is to point to its excellent description of reference ranges and what they mean. Reference ranges are the topic of some of the most frequently asked questions in patient online forums. Laboratory testing can produce a lot of anxiety. Before, during, and after, while you're waiting for the results, and the information on this site can be very helpful towards addressing that anxiety. So, and it has, you can see it's got, when it adds new tests, it's got down there at the bottom. It's got also different stories talking about the new website design, and it's got patient needs, understanding test results, different things like that. And then it has the top tests, conditions. You can view all tests as well. So Jerry Carlson in University of Colorado Health North at Fort Collins, Colorado, submitted Travelers Health. Now, when it came to Travelers Health, as a librarian in an academic institution, I was only really aware of this from just the Yellow Book, which is the guide, what used to be in public libraries and in my old library when I started many, many years ago when there's still paper. You used to have it and you would pull it out when somebody said they were going to go on a trip. And so that was the yellow book. Well, he writes, this traveler's health is maintained by the Centers for Disease Control. It tells consumers and their physicians what health concerns are especially concerning in places they're going and what vaccines and other precautions they need to take to avoid them. Users are asked the destination up front and any special aspects of the traveler or the trip, such as children, chronic disease, cruise ship, mission, disaster relief. For example, at this writing, he says, he is planning to take a cruise to Honduras. My search results tell me I need to have typhoid, hepatitis A vaccines 4 to 6 weeks before sailing, and may need hepatitis B vaccine, malaria meds, and or other rabies vaccines under certain circumstances. And this is what I did not know about. If you notice that there are these little check-off drop-down boxes that you click to find information. And he says that when he's done that, there's a warning that Zika is present there in Honduras. Other tips will help me to eat and drink safely. Don't eat bushmeat, monkeys, bats, and other wild game. Prevent bug bites. Stay safe outdoors and around water. Keep away from animals. And what to do if, say, jellyfish don't stay away from me. Reduce your exposure to germs. Outbreaks, diarrhea, or respiratory disease sometimes occur on cruise ships. Avoid sharing bodily fluids, get medical care, select safe transportation, and maintain personal security. So it's not just covering diseases, it's covering a lot more than that as well. I did not realize this part of the website existed. Now, travel notices I did know about, but it's good to know that that information is available right here all in one place. All are in pretty clear language, he writes. Final features of the page are healthy travel packing list for Honduras, any current travel health notices for the place, recommendations for if I'm not feeling well after the trip, and links to other resources are available. As are a mobile app version called TravWell and a diarrhea avoidance app called Can I Eat This? I find that I thought that was hysterical. So this is an entirely different way of looking at this website resource that I had no idea. So I really want to appreciate that Jerry submitted that. The next resource I want to talk about is from Andrea Haro. She is clinical librarian at Good Samaritan Hospital in Los Angeles, California. And she submitted this because she wanted people to understand first about the Medline Plus multiple language section, and then she wanted to bring to attention a specific language, which is Tagalog. So she writes, patient information in Tagalog is appreciated by staff and patients. We have many nurses who immigrated here from the Philippines and many Filipino patients too. The beloved Medline Plus language portal has links to topics in Tagalog. She also likes health information translations, quality health education resources for diverse populations. And this is through a wide variety of different hospitals in Ohio. She writes, I like this resource because it's easy to read, has the English translation accompanying the topic in Tagalog, and includes some simple pictures too. The topics are hospital relevant and include patient information about diagnostic tests as well as care after surgery. So I found that to be a very interesting website. Carolyn Bigelow, she is the Medical Consumer Health and Children's Librarian of the Children's Hospital of Pittsburgh at UPMC in Pittsburgh, PA. She submitted Genetics Home Reference, and so a lot of you may be familiar with this one, but I liked what she told me about it. She said, Genetics Home Reference provides information for consumers on rare diseases and conditions. It is part of the information resources provided by NIH. The website is very easy to read and provides constantly updated information on health conditions, genes, DNA, chromosomes, and basic genetics. And it is, if you want to learn some things about basic genetics, this is a great website. She uses this resource regularly for Amish, Mennonite, and other patients at her hospital who need to understand information about their new diseases. She has found that the provision of other names for the selected condition and the additional information resources to be invaluable. I also like the feature that allows for printing out the information in PDF form. So she submitted that, and you can see, like I said, it goes through. You can actually learn not only about conditions, but just basic genetics, which as a librarian who was not a science undergrad, I actually used this many, many years ago when I first started working more with patients. I went through some of this information. All right, now I have 2 websites that I wanted to submit. These are just websites that I find that I go to frequently. And because of that, I thought I'd bring them to the attention. It's not that they're necessarily new or exciting, but I just use them a lot, so I thought I'd bring them up. So the first one is the Plain Language Medical Dictionary from University of Michigan. I remember when this website came out, and it was years ago. I don't remember when. They say 2014, but I know that it came up before then. I think that was the last time they revised it, was 2014. This website is great because you can put in the term that you think is not as basic as what you might want to use with a patient, and it will, once again, it will translate that to something that's better for a patient with lower health literacy. So in this case, if you look up, if you browse, and you go to V and you look for vaccinate, it says to protect against disease, usually by shot. So when we had a grant and we were working on developing HPV vaccination guides, and we wanted them to get them to the 3rd grade level, which if you have human papillomavirus right there in the document, you pretty much are going to show that you're not at a 3rd grade level, but we got it down to 4.8. And we utilized this all the way through to develop those handouts. And I've got a link here to the handout. So the healthylinks.org, HPV Parents Individual Print, and then we had some other healthylinks.org disease. All of them we have several handouts. We have 2 handouts, one for parents, one for young adults, because that's the age group that needs to be vaccinated. And both of them can be found under the healthylinks.org disease _1228.html. A whole bunch of other things that we developed are there as well under HPV. So we have utilized this in developing information for grants. We've used this in other just basic information, like if I'm making signs for a consumer health table, and I want to highlight something, but I don't know what's the best terms to use, I come back to this website and utilize it to find out what would be better terms for me to use for the public. So I like this website. This is just a personal one that I have found very useful over the years, and I think it's beneficial for, especially if you're a public librarian, to know that this is out there and what types of terms they're using. Last one I want to talk about is, I can't tell you, at least twice a week, I have someone who's a friend or a family member who wants to know, how many times do people die from X? Or how many people really get this disease or something like that? And so in this case, I find this section of the National Center for Health Statistics, FAST, Statistics by Topic, is phenomenal. I use it all the time. I also use it, say a researcher here or someone who's writing a grant, they're applying to do a clinical trial here, and they want to show how our patient population, how we have more than this national average in the patient population, which in Louisiana, as we always say, and others will say, there are several other states that are much lower risk, but we're pretty much at the bottom level when it comes to some of these health stats. And so it's great to be able to go in and look up and find information. It has information on national averages, and then sometimes you can also even find state data. One of the other ones I think I looked up was diabetes, and it had some state tables in there as well that actually had Louisiana listed and had some data in there. But most of the time people are looking for the national averages, and if not more. And I wanted to make sure that people knew about it and were aware that this is where you can go to find this stuff really fast. If you have this bookmarked on your machine, you can pull up something and find it almost always in a matter of short minutes. So So that was the last resource, and I hope that many of you enjoyed that. I want to stop sharing my machine right now, and I want to open up the session and see, does anyone have any other suggestions? They don't have to talk. You can type it in the chat, or if you have access and want to unmute yourself and recommend a source, that's fine too. If you chat and say you want me to unmute you because you don't know how to unmute, that's fine too. I'll give it a second and see if anybody wants to volunteer any other website. Ooh, we have a note from Karen Bendenson. She is saying that the CAPAS, which is the Consumer Health section of the Medical Library Association, is going to be coming out with the CAPAS Top Health websites you can trust. Karen, will that be on the public side, or will that be on the CAPAS only member side? Do you know? She says it's going to be on the public side. And so that's great, Karen, to know that those resources are going to be on there. CAPAS Top Health websites you can trust. And does anybody else have anything? Do you know when that's going to be coming out? Ashley, she works for the Centers for Medicare and Medicaid Services on the From Coverage to Care C2C initiative, which CMS designed to help consumers understand your health coverage and connect to primary care and preventive health services. We have a consumer-facing, partner-facing resources. I think this is, I'm pasting this in, David. I think this is the website, or you can email her if you have any questions. And so I'm going to put that in here. That's Ashley's email. Well, that's the Care2Care website email if you want to ask any questions. So Judith has volunteered AboutKidsHealth. And she says, AboutKidsHealth is a health education resource for children, youth, and caregivers that is approved by healthcare providers at the Hospital for Sick Children. AboutKidsHealth empowers families to become partners in their own health care by equipping them with reliable, evidence-based health information. So, and she does not give me a URL. And she says it's got great drawings and videos. And maybe David, my cohort, who's posting all of these links, he can find this AboutKidsHealth through the Hospital for Sick Children. But I don't know if he'll be able to find that. If I try to find it, I'll crash my website. So that's the reason why I had David help me out. And he's been invaluable. Does anyone else have any other resources they'd like to recommend to the group? Oh, and Judith also says that this kid's, she posted the link AboutKidsHealth, but she posted it to me privately. So I don't think that she saw that, but I've got it posted up now. So it's AboutKidsHealth, and it also has in multiple languages, she says. Does anybody else have any suggestions of good websites? All right, well, it's 12:45, so I am now going to finish up. So our next event is Discussion 12, repeated twice. Discussion 12, working with local teachers and healthcare organizations to promote consumer health. So in this session, we are actually going to have public librarians, we're going to have some teachers, and we're going to have some discussion about why they wanted to join and partner up to apply for grants in order to do consumer health, bring consumer health knowledge in whatever format to their constituents. So we're also looking at getting someone who's partnered with a religious organization for a grant, and then also some other different types. So this is going to be more like a mini sessions within one session. The whole purpose is the National Network for Library and Medicine, who supplied the money for us to do this grant, has money for people to tap into in order to do projects within their communities. Or let me rephrase this, most national networks for libraries and medicine. South Central region definitely has it. There are other regions that have some. Some regions don't do that, but we're lucky down here in the South Central region. I think Midwest has grants as well. If those are available at your National Network Library and Medicine regional office, if you're not a member, you can become a member fairly easily. You fill out some paperwork, send it in. You don't pay anything, nothing like that. You can become a member and then you can apply for these grants to try to help your community. So one of the things we'll be doing is highlighting some successful projects in the next session. The registration link David's already posted, and you remember you only have to register if you want to get the calendar reminders and such. You can join the session using that same link after the session starts, but if you do that, you have to have the password GeauxConsumerLA, all one word, lowercase, in order to get in. That's a quirk of the WebEx system. That's all. That's the only. Please encourage. The last day is March 31st. Go to your staff. Go to your friends. Encourage them to utilize this education. Encourage them to get their CHIS, especially if you're in Arkansas, Louisiana, New Mexico, Oklahoma, or Texas. The fee is waived as long as I get all of your documentation by March 31st. Go to our website, check it out, find out what you need to do, because we want to be able to utilize this as much as possible before our end date. All right? And so now the thing that everybody really, really wants, here are the 2 links for our credit for today. And as I said, there's no pre-session reading, so you can, if you've sat through this, you can go immediately, go to these websites, fill out evaluation for this session for me to collect the data for the grant, and then also the MLA evaluation in order to collect the CE for your certificate. With that, I'd like to thank everyone. If anybody has any questions, please contact me. Hopefully we will see all of you on March 28th for our very last session. Thank you for attending today. Bye-bye.